Good afternoon, everybody. Thank you for joining us this afternoon for a special treat. We're going to hear from Dr. Little, who is the Chief Medical Officer of Piedmont Newton Hospital, right here in Covington, Georgia. And so Dr. Little is who we talked about in our earlier meetings this week, and he's going to be able to share quite a number of things with you about COVID-19 and the safety precautions that are important for us to have in place as we open school and teachers are back in place and school leaders are monitoring and taking care of all the safety concerns in our buildings. And I'm so excited he's here and agreed to work with us and to partner with our school system so that we have the support of Piedmont Newton Hospital. And so let me tell you a little bit about Dr. Little. As the Chief Medical Officer, he oversees medical staff services, wound care, and is part of the quality department of Piedmont Healthcare. His responsibilities also include medical staff governance, oversight, and implementation of quality and safety programs at the hospital. Dr. Little joined Piedmont Healthcare in 2016 after practicing 32 years as a primary care internal medicine physician in the Covington community. During this time, he was active in the hospital's leadership as well, and active in the quality program, serving as chair of the Credentials Committee, Physicians Quality Improvement Committee, and Infection Prevention Committee. He served as chief of staff for 3 terms and chair of the medicine section for 2 terms. Dr. Little received his Bachelor of Arts in Chemistry from Vanderbilt University and his medical doctorate degree from the Medical College of Georgia. He holds a board certification in internal medicine and is married to Frances Siebels Little and has 3 married children and 5 grandchildren. And I just want you to know, as the staff members and the support teams in our school system, that Dr. Little's presentation when we visited the hospital just about a week ago now was so very informative and shed a lot of light on the things that we could do and should do in an effort to ensure that we provide the safest environments for both our students and our staff. So without delay, I introduce to you Dr. Little.
Good afternoon. I'm very happy to be with you this afternoon and to speak to you about our experience at Piedmont Newton Hospital and the Piedmont system in general regarding dealing with the current pandemic with COVID-19. And just a little history around that. When this illness began to be publicly reported through China and then began to spread around the world, we began to look at that and, kind of monitoring that situation. And of course, it showed up on our West Coast and in the Northeast, and Piedmont Healthcare as a system began to actively prepare for what we felt was going to be the inevitable arrival of the illness in our own communities. And so March 13th at Piedmont Newton, we began to see patients that we suspected had COVID-19 illness and stood up our incident command center, and Piedmont Healthcare as a system stood up an incident command center. And what's important about that is that as a hospital providing health care to our communities, we did not have the option to close and to shelter in place did not exist. The option for us was to prepare to care for patients with COVID-19 and to also to continue to care for patients with the other medical illnesses and conditions that existed in our communities. And that was our mission, and we began to work on that process of determining how to do that. We certainly took our guidance from the CDC, from the Department of Public Health, but we also formed a task force with multiple other entities in the Atlanta area, Piedmont, Emory, Wellstar, the CDC, what I consider kind of the best and the brightest people out there to get together to look at how we were going to provide care for patients and how we were going to create a safe environment for our staff, which was critical. Hospitals are very employee-intensive organizations. Throughout this pandemic, in any given day, we probably have 400 people working under the roof at Piedmont Hospital, and one of our highest priorities was how to keep them safe through this and to prevent the spread of the disease within the facility. And so we certainly have had, at times, large numbers of patients with COVID-19 in the hospital, and it's been up and down over the last 5 months. And what I want to share with you today are the things that, the processes and the procedures that we were able to put into place and the effectiveness of those process and procedures in keeping our staff safe. And that's the goal of what I'd like to do. A couple of things about the illness itself. People frequently want to compare it to influenza, and it's not influenza. It's another viral illness, same family as some of our common cold viruses, but it can cause a much more serious disease. But in terms of the dangers of COVID, if you look at the data around mortality, and unfortunately, when I know everybody looks at the media and looks for guidance, and there's a lot of information out there, but the illness probably is less dangerous than influenza. However, the difference between this disease and influenza is that none of us have any immunity to it. So instead of a few hundred or even a few thousand people getting sick from it during a typical flu season, this illness could potentially infect 40 or 50% of the population, and that's what makes it most concerning to us in the medical community. The other issue about the danger of the disease is there's a lot of different information out there. So if you look at the mortality for a young person under 14, it's probably about 0.009%. It's very low. So children generally are not severely impacted by this disease. But then if you look at the very elderly, the nursing home population, the mortality can be very high. And so the measures that we are putting in place are to protect everyone. We want to make sure that everyone is protected and that we try to decrease the spread of the disease to protect those that are at risk. So what have we been able to do at the hospital? Well, it's been a learning curve. We certainly put all these patients that came into our facility on isolation, and we used PPE, including masks, of course, and gowns and eye protection in those patients that we knew had COVID. And what we found is that our staff did not contract COVID from hospitalized patients. So the very clear information that we had around this was the PPE measures that we had in place were effective. They did not result in transmission of COVID from patients to staff. But early on in the disease, at the hospital, if you weren't taking care of a COVID patient, for example, people weren't required to wear masks. And so what we did see were people getting COVID out in the community in different areas, sometimes staff members transmitting it to other staff members. And so very soon after that, we implemented universal masking in the hospital, where every person wears a mask all the time, unless they're sitting in an office by themselves. And the result of that was we pretty much eliminated the spread of this disease, at least in the hospital setting, with our staff. And we also asked our patients to wear masks where possible. This disease is transmitted predominantly through airborne. Probably 96% of it's transmitted through airborne, and only about 4% is transmitted through contact, where you might touch something and then touch your mouth or your face. So the most important thing that we could do were the things that are recommended by the CDC, which is wear a mask, social distancing, and in situations in the hospital where there's a very close level of exposure with certain procedures, we also recommend eye protection. And so the message that I can give to you is that wearing masks is highly effective in terms of protection and prevention of spread. And that's what we have found in our experience at the hospital in direct patient care of patients with COVID-19. Now, there are a lot of other kind of nuances about that I'd like to discuss as well. When we say this is transmitted through the air, it's usually from droplets. So when you talk or sing, or even sometimes even breathing, when you exhale, there are small water droplets that then pass out into the air. And most of those droplets are large enough and heavy enough, you can't see them with your eye, but if you ever talk in a mask, you will note that there's moisture that develops on the inside of the mask, and that moisture would normally go out into the air. Most of the time, those droplets are small enough that within about 6 feet, they fall to the ground. And that's why when the CDC recommends masking and social distancing, that's the reason for the 6-foot rule. Now, there are probably some activities that would extend that. So, forceful talking, singing, there are some activities, coughing, where that distance might exceed beyond that 6-foot range. But for most things, the 6-foot range is appropriate. So, the problem with social distancing is that it isn't always possible to do that. We in the hospital, we have 400 people, and you're in nursing stations and so forth. We would like to social distance, but it isn't always possible. So the universal masking helps to kind of put that barrier in place to prevent the spread of the disease, especially when the social distancing isn't possible. The other piece to this is how long you're with somebody who might be infected. And again, the mask helps with that, because there are times when staff may need to be around, one another, or they may need to be around a patient much longer than the 15-minute exposure time that the CDC recommends. And so again, the mask and at times eye protection is the measure that we use to prevent that from occurring. I am, personally, based upon the experience that we've had at Piedmont Newton and really throughout the whole Piedmont healthcare system, and the data that we see, I'm very comfortable. I really personally would have no problems, putting on my mask and in certain situations, goggles or face shield, and going and providing direct patient care to a patient with COVID, because I think these measures are highly effective in preventing the spread of the illness. So I think universal masking is key. And in the hospital, it's just mandatory. So we coach one another. We have safety tools in the hospital we call peer coaching and peer checking. So if somebody like me walks out of their office and they forget their mask, well, my associate's going to say, Dr. Little, you forgot your mask, and I'm going to go back and I'm going to get it. And the other issue is that if somebody comes to our front door and they refuse to wear a mask, they're not allowed to come in the hospital. It's not an optional. It's just not optional. You have to wear a mask. And so, If you're a patient and there is a medical reason that you don't wear a mask, that's different. We certainly wouldn't require someone to wear a mask that's a patient if it was going to be detrimental to their health. But we really feel like it's incredibly important in order to help prevent the spread of this disease. When it comes to other measures, I frequently, when I talk to people, they want to focus on sanitizing surfaces. And of course, we, through this, have done a lot of extra cleaning and sanitizing of surfaces in the hospital. But if you do that, but don't pay attention to the airborne transmission, then it's just not really effective. And so we certainly recommend regular and frequent hand washing. We recommend regular, hand sanitization to help decrease that. But the really critical piece of this is really the mask wearing that's so very important. We have also at the hospital decreased the number of people in the building by not eliminating, but limiting visitors. And we certainly understand that people need sometimes people to be with them to support them during their illness. And so we do allow a support person that's screened and must wear a mask. But, when I look at, for example, what you're talking about in the school system where you're going to have fewer numbers of students present, in some ways that's helpful because it does increase your ability to have some social distancing in place and there are just fewer people. It's all a matter of risk. If you have 100 people in a room, your risk is higher than if you have 50 people in a room, and that's higher than if you have 20 people in the room, and that's higher than if you have 10 people in the room. So it's all a matter of just kind of lowering the risk, and so mask wearing, hand washing, social distancing, and trying to keep numbers smaller where possible helps to decrease risk. I think I have, in thinking about schools, y'all have you have a very complicated situation. You have students and teachers. You have younger students and older students. There are sports activities. The key for young people, at least, is that they're very unlikely to get seriously ill from this disease. I know the news media is very good at finding every single young person in this country who's, had a bad outcome. But if you did that for influenza every winter, it would fill up our media because the number of young people that are adversely affected by influenza every winter is much, much greater than that from this particular illness. But in terms of protecting yourself, I think the key to it is wearing a mask. If you're in a situation, I was talking to a preschool group where there are, really young children that they were caring for, and where they're, young children less than 5 really don't have much hygiene at all, and I did recommend that they wear eye protection. So, like you can get eye protection at Home Depot with some safety goggles. You can wash them with soap and water each day and reuse them. They don't have to be thrown away. But if you're in a situation where you're going to be exposed to a person that can't control their coughing or their sneezing or their, other, drooling or things like that, then, wearing some kind of eye protection is helpful. It's probably not essential all the time, but it's certainly not harmful to do that. And I say that because that risk is theoretical. We certainly recommend it in the hospital in certain settings, but we don't know for certain about the transmission of this disease in terms of the mucous membranes of the eyes. And so we err to the side of caution in the hospital setting for sure. And our staff that are doing very close direct patient care, we recommend they wear some goggles or a face shield. There are other measures that you can put in place. Some people I was seeing are putting up plexiglass barriers in some situations if people are talking regularly, and those are effective because, again, what that does, that barrier just blocks the droplets from moving on out into the atmosphere. And so I think that, and at least for me, in terms of dealing with this disease, if I'm taking the precautions around this illness with mask wearing and, when necessary, eye protection, then I feel very confident in the ability of those measures to prevent the spread of this illness from person to person. And just my own personal experience, I have a son who he and his wife live in Colorado, and I hadn't seen him in a long time. So I'm like everybody else, you want to see your kids. So my wife and I flew out there. We had on our masks the whole time, and we wore eye goggles all the time we were in the airport and on the plane, and I really had no concerns about that, even though I was on a plane with 120 other people, because I think the measures are very effective. And so I just would like to help people to understand that it's important. We, in our communities, and I feel like I have a responsibility to speak to this, I want to encourage our communities to wear masks. I will tell you my experience over the last 4 or 5 months here in Covington. We, of course, went through the initial surge of COVID patients at the hospital. And, we saw a pretty significant increase in the numbers of them there. And it peaked around mid-April. And then it began to go down. And I live here right in town. I shop here, go to the store here. And so we would be out and about here and there. And what I noticed in terms of the behavior of our community is that I would go to the grocery store or Home Depot or the hardware store, and pretty much nobody had a mask on. And then I began to see in a couple of the restaurant areas that they were packed with people without masks, and I knew what was going to happen. And about 4 weeks after that, we had a surge in Covington that was 4 times as great as the one that occurred in April. It was a bit, as a person who was responsible for, the care of the patients that come into our hospital, it was concerning. And then I was out in Home Depot, I think this past Friday evening, and what I saw was everybody had a mask on. And so what I see now in our community, now that behaviors are different, is that the number of patients that we're seeing come into the hospital with this illness has gone down. And that's just another testimony to the fact that wearing a mask is effective. Doing these things, the social distancing, the masking, and when necessary, using the eye protection is effective in prevention of the spread of the disease. I would like to just mention testing for a moment. People always have questions for me around testing. We do COVID testing at the hospital for patients that are admitted. Unfortunately, we don't have enough test kits to we would love to be able to do it for our whole community, but we don't have the test kit capacity to do that. About 2 or 3 weeks ago, we began testing patients that came to the emergency room with symptoms, and so those are being sent now to Piedmont, Atlanta to be run. So we have been able to increase our testing, but there are some things you have to remember about this disease. This illness is very much like other viruses. I know we don't see much, chicken pox and measles and all that sort of thing anymore, but chicken pox is a good example. When a child breaks out with the rash of chicken pox, the day before that, they already spread it to their 10 best friends, before they ever had a fever, before they ever had symptoms. And that's true with this illness. So this is just like most viral illnesses, that we are actually contagious with colds and influenza and most of our illnesses before we develop symptoms. And COVID is no different from that. So that's why in the hospital, we are so insistent on the masking, because we screen everybody that comes in. We do temperature checks and we ask them if they have a cough or any other symptoms, but we know that many people can spread the illness before they ever have a symptom. And so that's the other kind of rationale behind the masking and why that's so important. The other piece to testing is that people want to, if they've been exposed, I want to make sure this is clear. Let's say I don't have a mask on and I'm around somebody for 30 minutes and they find out the next day they've got COVID. And that internally, the next thing I want to do or might want to do is go get a test. Well, that won't tell you anything. You're going to have to wait at least a week or 10 days because the incubation period for the disease is probably about 4 days, and early testing early in the illness may not be as accurate. So if you're the testing for exposure generally is not all that helpful or recommended. The other question that I frequently get is about serology, and most of the physician offices in the community do serology testing, which means that if you think you might have had it, you can go get tested, and that might help you to answer that question. But there's still a lot of uncertainties about serology. So it is being done, and we're trying to look at that to determine whether it gives us the information that we need to have confidence that a person has had COVID or not, but there's still a lot of research that needs to be done there. So I have known many people, I've had friends who've had COVID. Most of them have gotten, well and better. I know people that have gotten very sick with it as well. And our goal, of course, is to try to, decrease the numbers of people that get it, protect one another, protect our community, and get back to the things that are important. I think, my personal feeling is education is extremely important. We need our children to have the opportunity to learn, to be in the environments that are going to set them up for success in their lives, and education is an extremely important part of that. So I want to be able to give you the assurance that using our PPE is effective, so that you can do your work and be confident that you're going to be safe if you do that. I will tell you that part of one of the biggest challenges that we had at the hospital for our staff, and these are people that are going home, they're taking care of patients that have COVID all day long, and they were scared to death that they were going to go home and give this to their family. And And we have not really seen that. My recommendation around that is that people, if they're using cloth masks, that they use the kind with 2 layers of quilting cotton or shirt cotton, and then they clean them regularly. They should have 3 or 4 of them, and then they can, kind of wash them on a regular basis. And that if you're in situations where you're in with young children, or maybe children with disabilities of various kinds, where you're in very close physical contact with them, that you might want to wear a smock or something that you can clean as well. But there's really not evidence that you're going to carry it home. If you wash your hands, you get, clean the mask, there's really not evidence that you're going to take, this home on your clothing or, that kind of thing to other individuals. And so I do hear that as a concern from people, and I wanted to speak to that. There also is the issue of being immunocompromised, and being in a high-risk group. Well, as CDC would define it, I'm in a high-risk group because I'm 65 and over, so that puts me there. But I really don't have concerns around that. If I was actively getting chemotherapy for cancer, if I had a genetic immunodeficiency disease, if I was getting any other kind of drug that depressed the immune system, like high-dose prednisone, then I might have some additional concerns about exposure to the disease. But for most of us, those concerns are not that great, are not that significant. And I think that using our PPE and wearing our PPE is adequately protective. The other question I get asked a lot is about hand sanitizing. So the 70% alcohol hand sanitizers are effective. I just want to reiterate that you be careful about where you get those. There have been products on the market out there that have methanol in them, and they're dangerous. So just make sure it's a reputable company, and where you. I mentioned a couple of activities. I will tell you that I go to church and I love to sing, but singing concerns me. And I'm probably singing as a part of school, but at least for adults. Now, if kids want to get together and sing, that's fine. But I think that it's one of those activities when we've seen major spread of the disease. It's been in some church situations where choirs have practiced together for a couple hours singing, and one person spreads it to 50 people. It's one of those activities that may, if you wear a mask, it probably would prevent that. But it's one of those activities we would say that may be higher risk in terms of spreading the disease if it's done without wearing a mask. There's a lot of data on the kind of mask to wear. I get asked, well, should we wear N95 masks? That's what we use in the hospital for exposure to patients. But I would tell you that the surgical mask that I have on is mostly what we had early in the course of this at the hospital, and it worked quite well in prevention of spread and protection. There is some controversy around I can't remember what they're called, the things you pull up over your nose and face that are made out of a more elastic material. And I don't know that we really have the data where I could recommend that as the primary method of protection. I would still, I think, recommend what we know for sure, and that's a 2-layer cloth mask that uses quilt fabric or shirt fabric. and or a surgical mask, a medical mask would be fine as well. People ask also about there are masks you can get from the hardware store that are N95, and we have actually used those in the hospital setting as well, and they would work also. I would ask that you not wear masks, though, that have the little exhale port on them, because although those masks do protect you, they don't protect other people, because your breath, when you exhale out of one of those masks, that air goes out into the atmosphere unfiltered. So we would recommend that you not use that kind of a mask. And the last, and I'd like to leave plenty of time for questions and answers, but I would say that with this illness in the last 5 months, we have improved our ability to care for these patients. Fewer patients with COVID are ending up in the ICU. Fewer are ending up on the ventilator. We do have some treatments that we're using that are proving to have some effectiveness. So from that standpoint, from a medical standpoint, we're encouraged around that. And the other piece around that is just that, the hospital is certainly here to serve the people of the community. We have been able to provide treatment for every person. So you and your families, if there are medical conditions that people have, we encourage you to get medical attention. The medical offices and the hospitals are safe places to go here when it's appropriate. So I try to sort of think through things that you might have questions about, but I always have additional questions, so I want to be able to answer those. So I think y'all have a way to provide some questions, and I'm happy to answer those.
All right. So at this time, if you do have any questions, feel free to add those into the live chat, and we'll ask those at this time. But Dr. Little, I'm going to ask you the hard-hitting questions, because I get all my medical advice from Facebook. And Facebook tells me that wearing this mask, I could get too much carbon dioxide and I could pass out by wearing my mask all day.
So, in the healthcare profession, we've been wearing masks for a long, long time. And we'll have surgeons in a 15-hour surgical operation, and there are no issues health-wise related to mask wearing, with the exception that if you're using reusable masks like cloth masks, they need to be regularly cleaned. Okay. So other than that, there are no health issues that I would be concerned about from wearing a mask.
All right, and here's another hard-hitting question for you. In schools, we have a lot of paper and textbooks. And once again, I go to Facebook to get my medical advice. And I need to know, how long should I keep paper isolated if students have been touching them, or books?
So if I were, let's say, I gave a test at school and they all took the test, they passed all their papers in. Of course, they may not do this in school anymore. I don't know if it's all done on a computer, but back when I was in school, that's what happened. So I got all these papers from all the class, and I probably, what I would do is I'd keep my mask on, maybe if the important thing, if you're doing that, you want to protect yourself, is not to touch your face. So, and I would do all my work, and then I would go wash my hands, and I wouldn't worry about it. I wouldn't give it another thought. And because it's effective. Hand washing is effective. Hand sanitizer is effective. So, avoiding, touching especially your nose and mouth areas, if you're doing something, and that's sort of true for flu and for many other illnesses as well.
All right. Next question that we have here. Is the hospital at max capacity for COVID patients?
No. So I'm going to be, about 4 weeks ago, we were close to that, but we're, right now, the prevalence of the disease in the community has significantly decreased, I think, because of the behaviors that people are currently engaging in. But no, we are not at max capacity at the moment.
Okay, so from your 3 answers you've given me so far, it sounds like I should not believe all the things I hear or read on Facebook.
That would be no. I don't. There are many things. So I don't like to assign wrong motive to people, but information is a very difficult. Managing information is very difficult. In this age that we live in, if somebody does a study and it is instantly available to everyone, and the problem with that is that who interprets what that means? And so what I see frequently is that people take information and then it gets kind of spun in a way that really the study wasn't intended or designed to really support that particular theory. Mm-hmm. And so it's really difficult. I think that's why we had so much success in the Piedmont system, because we pulled together some very bright people to kind of filter through that and to make recommendations that really have been highly effective for us.
So no one asked this question, but I'm going to follow up with that one. Where do you recommend the average citizen get their information to kind of be the most current with as it relates to COVID-19 and other infectious diseases that are out there?
Oh, boy, that's a tough one. So I'm a medical professional, but I read through this stuff, and it takes me quite a long time to filter through it, because, like I said, everything is out there. Mm-hmm. I mean, the good, the bad, and trying to filter through it. I think the CDC's recommendations are good. The problem there is that sometimes when they tell you something, the problem you have is then how do I take what they're telling me and then apply it to where I work, or apply it to my home, or whatever it is. And I think that is where the struggle is sometimes. But I do think that they are doing their best to objectively look at the data that's out there and provide, good recommendations. And but the other piece to that is we're learning new things all the time. So sometimes things change, and a lot of times the recommendations from the CDC have a lot to do with disease prevalence. For example, they just eliminated their recommendation that people self-quarantine after traveling. Mm-hmm. So that was a recommendation prior to 2 days ago. Mm-hmm. And part of that it's because, so I'm probably no more at risk from traveling to Colorado than I was for going to the grocery store. Mm-hmm. So it doesn't make any sense to do that. So one of the things that we're trying to do and be assist with in the community is be a resource for information. I want our community and I've been on phone calls with our community leaders and government leaders on a regular basis, so that we can together kind of filter through this information and help the lay public to kind of understand what this means for them and how they can best protect themselves and their families from things like this. So that's a very difficult question. I think it's very challenging in the current media environment that we have to sort of have a go-to source for that kind of thing. It's very tough.
Now, I did warn you, I'm going to come with the hard-hitting questions here. So I did warn you. All right, so our next question, someone wants you to kind of repeat your statement about prednisone and other corticosteroids that are out there.
So I think that had to do with people that their immune system was compromised who are at higher risk. And the current recommendation are people that are on greater than 20 milligrams of prednisone per day or the equivalent would be a person who's at higher risk of having their immune system not be robust like it should be. So that's a fairly high dose of prednisone. Most people aren't on quite that much. And now on the other hand, we do use steroids and prednisone to treat COVID. So that's, there are kind of two sides to that particular situation.
All right, and this one, someone wants to know if a teenager has asthma and Kawasaki syndrome, are they at greater risk?
So in my reading around asthma, there's been some theoretical risk, but most people that are that have active asthma are on inhalers, and those inhalers actually lower the number of ACE2 receptors in the body. And that's a good thing because this virus hooks onto the ACE2 receptor. That's how it gets into our system. And so the treatment for the asthma actually lowers the risk for getting severe COVID. That being said, there's still some theoretical risk there, but we haven't seen that in, if you look at young people that are developing severe COVID disease, it really hasn't been patients with asthma. Now, Kawasaki's is a bit different. Kawasaki's disease is an immune response that's not well understood, that happens with certain viral illnesses. And, I think that would be a question that I would take to my pediatrician and just ask them that, to get their opinion about that. That's a little bit different situation.
All right, and I think you may have touched on this one, but this is a good question. I want everyone to hear it again. What is the risk of children picking up this virus and bringing it home to family members?
There's a lot there. Every time I read some opinion about that in the media out there, it's different. There are people there are experts that don't think children are high-risk carriers of this disease in terms of carrying it to others, and there are others that would disagree with that. And so the answer to that is we haven't tested that, and so I don't think we know for sure. My experience with infectious disease historically, though, is that children do a pretty good job of carrying illnesses around with them to others. So, however, mostly what we've seen, and I think it's because schools haven't been in session, is that parents are bringing it home to their children. But the children don't get serious illness, but that's mostly what we've seen. So I don't like to speak in spaces where we don't have data. And right now, we don't have data except for, kind of saying, well, yes, in other illnesses like flu, they may, they'll tend to bring it home sometimes. But I think the advantage with children, this illness is this illness in children is much shorter in duration. So the time period that they're actually contagious is probably going to be much less than in an adult. So it's certainly possible, and but if I were in a younger child, where hygiene is more difficult, that might be more likely than an older child, like a high school age child, a young adult.
Okay. Next question that we have here. Would you say that the home tests through LabCorp are accurate?
Home test for COVID?
COVID.
Not at the moment. I think they're probably going to have about a 30% false negative rate, which is pretty high.
All right. Would you recommend an individual take supplements to boost their immune system during this time?
So there's been a lot of investigation into zinc and vitamin C, are the two that I've seen most studied. And although they don't seem to cause any harm, we're not sure whether they help or not. And so, I guess my recommendation is, taking some supplemental zinc and vitamin C is not harmful, but we don't know if it's helpful.
Okay. Any additional questions? If y'all want to add those into the chat, I'm kind of going through these. A couple of these seem as they're repeats. All right, here's one. With flu season fast approaching, what would you say the chances of this virus mutating?
So, the virus, I don't think the flu season coming on has anything to do with this virus mutating. Viruses in general do mutate to some degree, and this one already has over the last year, since it probably started in China probably not quite a year ago or, close to a year ago. There has been some mutation of the virus. So far, worldwide, there's been only, out of the millions of people who've gotten this virus, there's only been one case of somebody getting it a second time. So I think that's encouraging to me, that we can, that people will develop, persistent immunity, and that ultimately vaccination will be a helpful tool. But I think the challenging part about the influenza season coming on is distinguishing between this illness and or COVID and influenza. So at the hospital, we'll be running both tests. So we'll be, and people that are sick enough to be hospitalized, we'll be testing for both influenza and COVID, probably starting within a couple of months from now.
And this is something that I found a little odd. I went to CVS the other day to pick up a prescription, and they were already asking me about the flu vaccine. So with that being said, would you recommend teachers or employees or students get their flu shots?
I would recommend that you get your flu shot, starting, I think it's a little early yet. We're, September, we like the flu vaccine to last about 6 months, and it isn't always the case, but typically influenza in the South tends to peak up, more in the late November, early December time frame. So we recommend vaccinations, September, October, being a good time to get a flu shot. And we would continue to recommend that, yes.
Okay. A couple more questions. Here's one. Are there any known long-term side effects of individuals with COVID?
So we didn't get into that too much, but the answer to that would be for people who develop moderate or severe illness, they can have some long-term issues related to that, both lung and heart. And there have been a few other things, chronic fatigue and some other kinds of things related to that. but not so much for the person who has mild or no symptoms. So the other thing to speak to that is that about 40 to 50% of people that develop COVID have no symptoms. And when I say no, I mean like zero. Not a sore throat, not a runny nose. They just have no symptoms. And so, the vast majority of people, 90% of people get over this illness without any long-term effects whatsoever. But there are going to be a few, the ones that get moderate to severe illness that may have a protracted, they may have longer-term symptoms after the illness is gone.
Okay. All right, so Dr. Little, as we wrap things up, what is something that you would like for everyone out here watching, or those administrators that will watch this again, can take from you to kind of go into this upcoming school year?
Well, I think that the the message that we can be protected from the illness with the measures that we understand to work, I think is the important thing. That wearing masks is highly effective in prevention of the spread of the illness, and doing your hand washing and so forth, and that in some situations eye protection may be helpful. And the other, I guess the other thing I would offer related to that, if there are specific situations that exist, I don't know every situation that every person is dealing with, but if there are specific situations that people want to ask about, we can certainly look at that and see. For example, if somebody is concerned, well, should I wear goggles or not wear goggles or something like that, depending on their situation, and sometimes I think the answer to that is, if you're worried about it, just wear them. They're not, there's no harm in doing that, and they're easy to clean and wash. But there are some situations sometimes that may be more complicated, and we're certainly, willing to help with that. Like any other illness, there's no way to reduce the risk of anything to zero. Just like if I get on the highway and drive to Atlanta, I can't reduce my risk of having a wreck, to zero. But I do think we can provide environments with this disease that are safe, so that people don't have to be worried about it. And I will tell you that our hospital staff now, they're very comfortable, because they've been living with us now for 5 months, and so they have confidence in the processes that we have. They're no longer kind of constantly worried and frightened, and that something, they're going to get this or something's going to happen or whatever, because they've had an experience now ongoing for a period of time that they're going, wow, this works. Nobody's getting sick. Nobody's coming down with this illness. And so I think that's a very key message, that these things work and they do protect us.
Well, thank you, Dr. Little, for sharing that information with everyone. And remember, everybody, do your part, wear your mask so school can start, and have a great day.